Well, we're joined now by the current Minister for Health, Stephen Donnelly. Good evening, Minister. Thanks for joining us. Our viewers are going to be looking at that. They're going to be thinking this story is a hardy perennial. It's just as traditional as the Christmas tree and it's just as predictable.
I think so. And I think what the package there shows is that this is something that the Irish Health Service has been dealing with for many, many years.
And yet it's worse than ever.
It is worse than ever. However, we do have a unique context this year. There's a perfect storm this year of COVID, flu and RSV. We're seeing right around Europe some of the best resourced healthcare systems, some of the best run healthcare systems in Europe under similar pressures.
And that is true, and that is a plausible enough argument, except that this was predicted. The twindemic certainly was predicted as far back as July. Tony Fitzpatrick of the INMO, unless we see a hospital-by-hospital plan to tackle overcrowding, we are in for a very bleak winter in Irish hospitals, which will see nurses and patients in extremely unsafe circumstances. That alarm was raised in July.
Oh, and including by me. We were talking about a perfect storm. We watched what was happening in places like Australia.
So it was entirely predicted. You predicted it.
Yeah.
And why are we still facing this problem?
Well, the ability to predict it does not mean that you can, in 6 months or even in 3 years, deal with legacy capacity deficits that we've seen in the package there. So we know that there hasn't been sufficient capacity in the Irish healthcare system for a very long time. So what are we doing? We are expanding capacity in the public service at a level that has never before been seen. So over the last 3 years, we've added more beds, more critical care, more staff than ever before. Now, is it enough?
No,
it's
clearly
not. It's not. Yeah. But let's acknowledge that there's been a bigger expansion in the last 3 years than ever before, and we're going to continue with that expansion.
Okay, but that is not even keeping up with rising population and an ageing population.
Well, it will. So this year, for example, this will be the 4th year of record recruitment into the HSE, the 4th year of record recruitment in a row. We've about 4,500 more nurses and midwives than we had at the start of COVID. We've sanctioned a lot more hospitals. And critically, David, not only are we building up capacity, but we're investing in community care, because a lot of the solutions to emergency department pressures are found in the community, keeping people well and treated at home, in general practice, or in the community.
OK, you made a big issue about discharges and consultants being available to discharge patients, particularly over the weekend. You've managed to upset a lot of consultants with that. But excuse me. But Stephen Mulvaney of the HSE said on Morning Ireland that there are around 550 patients whose discharge is delayed, not because consultants haven't signed the paperwork, but because there's no places for them to go. And again, this is entirely predictable.
It is predictable, and that's why we're building up community-based services. So we've seen a 40% reduction, for example, in the number of people waiting for home care packages. We need to go further, obviously. The point about running discharge 7 days a week instead of largely 5 days a week is we need to break this cycle of seeing very low levels of discharge over the weekend. So typically you see less than 10% of weekly discharge over the weekend. What we saw this week was a big build-up Monday and Tuesday, and that happens many, many weeks. So what we've asked the HSE to do, and what the HSE is doing, is looking to increase discharge rates this weekend and for the next few weekends.
OK, so normally on Monday and Tuesday you have the highest numbers of the week, so you have instituted a plan to try and cope with that. What represents a win? What's a number on Monday or Tuesday of people on trolleys that you will say, OK, the plan is working? Well, it was over 900.
I don't think it's helpful to pick a number and say above this is...
Well, how are our viewers able to determine whether the plan is working? How are you able to determine if the plan is working?
Well, so let's talk about where it is now. Over the last 3 days, there's been a lot of additional activity right across the health service, in the hospitals and in the community. And so we've seen the number of patients on trolleys half just in the next over the last 3 days. The latest figures I have...
Half to a number which Mary Harney declared a national emergency over.
Absolutely, but having the numbers in 3 days, I think we need to acknowledge that is good progress by the HSE. Now, the latest figures I have, just as of the last few hours, are that they're down further. We don't know as of yet what will happen over the weekend in terms of discharge, but we expect to see significantly more discharge than would normally happen, and therefore not completely get rid of, but help manage this Monday, Tuesday spike. OK,
one of the worst black spots is University Hospital Limerick. There's a new plan that will allow ambulances to take patients directly to Ennis, whose emergency department was closed some years ago. Isn't that proof that the closure of smaller emergency departments around the country has been a disaster. And campaigners, for instance, in Navan will point to that and say, don't close our ED.
I think Navan is a very good example of wanting to get it right. The proposal on Navan was that Navan would close before additional capacity was put into the ambulance service, was put into the community and was put into places like Our Lady of Lourdes and Drogheda. I intervened because what I want to see is it done in a way that the capacity is put in place first. I do think the ability to bring patients to the medical assessment unit in Ennis is a positive development and maybe something we can look at. It worked in Mallow, maybe something we can look at.
But it was closed because we were told that patients couldn't be treated safely there.
It was closed as part of a reconfiguration, and I think a mistake that was made at the time, and I think it was made in more places than Limerick, is sufficient capacity in Limerick was not put in place before those changes were made. OK, a lot of people watching this will say that this is not just a crisis, although it is a crisis. It's not just a scandal, although it is a scandal. They'll say that it's a failure to properly foresee what was going to happen, a failure to plan for what was going to happen, a failure to react quickly enough to what has been happening. Do you accept personal responsibility for that failure? What I want to do is, first of all, acknowledge the very real distress for a lot of patients in some of our hospitals around the country, for their families, and the very real pressure for the healthcare workers. What can government do? Government can sanction funding and agree to more beds, more healthcare staff and so forth. That has been done at a level never before been seen. And to the HSE's credit, while not all targets have been met, the HSE, and let's just think about this for a minute. Do you accept responsibility? I don't know much time, Minister. I just want to ask you this question. Yeah. Do you accept responsibility? David, what's happening now is happening all over Europe. So I'm the Minister for Health. Ultimately, the buck has to stop with me. I absolutely do accept that. But what I want to say is over the last 3 years, between government, the department and the HSE, we have expanded our public health service at a level never before been seen. We're going to continue with that expansion and continue with a fundamental reform, moving to community-based care to take the pressure off the hospitals. Okay. It is work that is going to take several years. We're 3 years into it. And I just want to say that in fairness to the HSE, in the middle of dealing with the worst health crisis in 100 years, they've managed to add capacity at that level. OK, Stephen Donnelly, Minister for Health, thank you for joining us.